I get it. You guys are being marketed the heck too. Everything is a need. Everything's so important for this baby. And then there's all these things for you, all the stretch mark cream and all the maternity clothes and all the things you absolutely have to have during your pregnancy. Today, I want to boil it down to just 5 things you really need during your 3rd trimester. These are things that are going to make your pregnancy, birth, even postpartum journey better. You might already have them at home, which is a real budget saver. So let's jump into them.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
The first one is a water bottle. Now, I specifically bought this water bottle because it is so bright. I thought it would remind me to drink. Like if I see it in my bag or I see it in my car, it will literally remind me to drink. Also, it's my high school colors, but I just thought it would be easier to find. I especially take this when I travel. I think it's also smart to have like a desk cup. So I have like a travel cup and a desk cup. And you guys are probably like, why the heck are we talking about this, Hillary? And I 100% understand that. But these are things that I've seen in my 20 years in labor and delivery, but also things that I've experienced with my 3 pregnancies. On my 2nd baby, I ended up needing IV fluids. I had a really bad flu. I could barely exist. I had a little kid at home. I thought I was drinking, but I clearly was not because I went in, they checked my urine. It was full of ketones and I could barely move. I barely made it into my appointment in the hospital. And she was like, Hillary, what's up? So she gave me 2 liters of IV fluid. And I cannot tell you how much better I felt when I was leaving the doctor's office. Hadn't gotten IV antibiotics or steroids or anything like that. It was just the fluids. And I felt so dumb because I 100% could have drank that, right? And instead, I invited them to put a needle in my arm and get it in that way. Now, sometimes that's the best way to get your fluids, but having a cup that you love totally makes it better. And I have a tip for partners. As a partner, fill up the water bottle every day. It's something small that you can do. It's going to help them feel better. And honestly, filling my water cup is the first step in a habit profile that increases my total hydration. Now, I bet some of you are going to say, Hillary, how much should I be drinking? And I'm here to tell you that you have a built-in barometer of when you're drinking enough fluids, and that is the color of your urine. Now, as someone who has had thousands, possibly tens of thousands urine samples handed to me, you can really tell a lot by someone's urine sample. Often you can tell kind of how they're doing in their life, how they're coping with things, because if you have a really dark colored urine specimen, it's possible that you have some blood in your urine from a kidney infection or a bladder infection, or you just are not able to keep up with hydration. Maybe you're like me, where I had that serious flu, or just something's going on in your life that's keeping you from drinking enough water. So when you go to the toilet, if it's a white toilet, so many people are getting these colored toilets now, but all of mine are white, check the color of your urine. Is it a nice light yellow? We're not looking for clear. I hear often people say, oh, it should be almost clear. No, it should be a nice light yellow. And the more you look at it, you're going to be like, okay, I look pretty hydrated right now. Or, oh, I'm behind. I need to drink more, right? And the good news is you're going to check this multiple times a day because you are pregnant and that baby is just a bouncing on that bladder. So a water cup is a need in your 3rd trimester. I cannot tell you how important hydration is. That baby will siphon away all of your fluids if they need it. So you got to pump in the extra fluids. And I know that means going to the restroom more frequently. For me personally, I would try and cut off most of my fluids after dinner. So I would drink a ton during the day and then slow it down at night. So hopefully I'd be able to sleep and only get up once or twice to pee during the night. Ugh, bladders during pregnancy. It's not my favorite part. And since you guys are likely in or close to your 3rd trimester, I actually have a whole 3rd trimester checklist that you guys can download. It has so many good things in there. You are not going to want to miss it. I'll put the link in the description box. The next one is something that you likely already have at home, and it's pillows. Now, I know everybody wants to sell you on the pregnancy pillow or a body pillow, but I'm here to tell you that just regular old bed pillows can be just as effective. And in fact, you can still even use like the fancy ones because, I don't like to use my fancy ones under my head, but under your belly, you're pretty unlikely to be getting it dirty, if that makes sense. So you can even use those fancy pillows to help you, probably already on your bed. My husband hates how many pillows are on our bed, and I try and keep it to a minimum. Now, some of you might be thinking, Hillary, where on earth can I put all of that pillowage? So I usually am recommending that patients sleep on their side or tilted a little bit. Now, there was a study that showed it really didn't matter how you slept, but I personally have seen with my eyeballs babies who really just didn't look as great when mom was on their back. So I still like people tilted a little bit. Take it for what it's worth. But if you love sleeping on your back, all you need to do is put a a tiny, thin little pillow behind you. And that is going to tilt your uterus just enough so it's going to stay off that vena cava and make sure that you're still getting good blood flow throughout your body. Now, when I was a labor and delivery nurse and that I first learned that the vena cava could be blocked off if you slept on your back, I freaked out. And my manager was like, Hillary, you know that if your vena cava was blocked off, your body is going to send alarm signals throughout your body and it's going to tell you to wake up. So don't freak out if you find yourself waking up on your back, but I do think it's nice to have a little wedge there if that is some way that you sleep frequently. Not really backed by science, just from my experience. Again, if you love sleeping on your back, talk with your provider and maybe you feel good about sleeping on your back, especially if baby's still moving and very happy in that position. Okay. So most of you are probably going to sleep on your side anyway, because a lot of people find that sleeping on their back, maybe their heartburn or whatever is worse. If you are sleeping on your side, I usually recommend 1 to 2 pillows under your head. You're going to want to slide one thin pillow under your belly, because if you're laying on your side, your belly is just kind of hanging there. And we want to prevent those ligaments from getting angry because the belly is just hanging to the side. So one thin pillow under your belly. I also recommend 1 to 2 pillows between your legs, depending on the thickness. You're looking for those legs to kind of just come out straight rather than if you are laying in bed without a pillow, they come closer together. So you're looking for those legs to go straight to help support your pelvis and those ligaments in your thighs. And then finally, I love one to hold. I think a lot of people just feel more comfortable that way. So those are the pillows that I would put on my patients to try and make them as comfortable as possible. Yes, as a nurse, I was always looking to have like 8 pillows in my room. That's just how a good nurse works. So those are the pillows that I recommend. Again, you can get a pregnancy pillow because it'll do a lot of these things for you. A lot of them are shaped like a U, but Hillary only had a queen size mattress and my husband would be like, where in this bed am I going to sleep? And I kind of thought, I don't care. But also I thought, let's try and make the bed hospitable for everyone in our family. So use pillows that you have at home. Look for body pillows. This is all actually one post on my website, Pulling Curls, because of the curls. I'm going to link that down below. It has links for things that I recommend in case you're looking to purchase something. Although if you have pillows at home, I'm here to tell you, just use them. Okay, the next one, which is probably not going to be a surprise to a lot of you who follow my channel, is to make sure that you are getting a birth class. And I know you're here watching me on YouTube and you're thinking, Hillary, am I not going to get all this information on YouTube? And I'm here to tell you, you are going to get a good amount of what is in my birth class here on YouTube. But you're going to get a lot of repeats, you're going to get a lot of ads, and is your partner watching these videos with you? Because most likely they are skipping a lot of them. Maybe you find 1 or 2 good ones that you send to them, but they are unlikely to spend hours on the couch just binging this. Although every once in a while I have a husband comment how much they love my videos. Shout out to the husband and partners who are watching this video with their partner. But getting a good birth class is going to make sure that you are getting it from start to finish. You're not missing anything, because if you just scroll through my different videos, especially just the ones that YouTube recommends, you're going to miss a good portion of that. And you're going to get in labor and you're going to be like, nobody ever told me about this. In fact, have you seen on social media? Tell me in the comments, have you seen on social media people who are saying, nobody ever told me XYZ about my birth? We don't need that. Make sure that you're getting prepared from beginning to end. It's going to be so helpful. Make sure that you are especially getting a birth class that talks about postpartum, because that is the ugly stepsister of the birth classes. And I don't know why, because I know for me, mine didn't prepare me at all. So when I made a birth class, I made sure that it included postpartum. And if you're one of those people who's just mostly watching TikToks and shorts, I'm here to tell you that those lack so much context and nuance. It may actually end up confusing you more than it helped you. So I'm glad you're here at least on a full video that helps you have that context and nuance. But getting a birth class is definitely the gold standard. And I know you're thinking, Hillary, I don't have time, or Hillary, I don't have money, but I really tailored this class to be extremely affordable. It is one of the cheapest birth classes that is out there, and to be time sensitive. So the main class can be done in just 3 hours. You can do it in what I call birth bites. You can just, shove them in during breakfast and dinner, and just 20 minutes here and there, it'll be done before you know it. The next one is a belly band. Now, belly bands just go under your belly to give you a little bit more support, both from your belly and possibly your pelvis. A belly band can help a variety of things. Now, not everyone needs one. I probably didn't need one on my first pregnancy because I was 24. I was young and vibrant. But by the time I was 32 having my last baby, I needed the pelvic support brace. So if you were having ligament pain, I have a whole video on ligament pain. I'm going to link it down below. Or if you were having any pelvic pain, I had symphysis pubis diastasis. I think that's the right order. And my pelvis was falling apart. So wearing a belly band lower on my hips would have really helped. Again, I go into this more in the full post on this. I link to ones that I recommend and different ones that might be good for different situations. But I recommend you take this recommendation to your provider or your next appointment. You're in the third trimester, so you're seeing them quite a bit, and see what they recommend for you. I know my first doctor said it would restrict fetal movement. I haven't seen any studies on that. I think he was just trying to cover his behind. But I do think it's important to take it to your provider. And bonus points, if you're seeing a physical therapist, they can help you out with this as well. And if you're like, I'm hurting a lot, make a relationship with a physical therapist. You are going to be so thankful for it postpartum. Do it. Now, this last one is going to seem like we are 80 years old. I remember the first time somebody recommended that I wear compression socks, and I was like, what the heck? I am not some old grandma. But I think compression socks don't get the highlight that they need. I think they can be very helpful for everyone on long flights. At Disneyland, these are the ones that I wear at Disneyland. I actually bought them at the Target by Disneyland because I forgot them. And these are the ones that I wore to work because being on your feet for 12 hours absolutely sucks. So they just helped my legs feel a little bit better. They helped with aching, they helped with swelling, and they can do the same things for you, as well as preventing any blood clots, which can happen during pregnancy. So there's different kinds of compression socks. Again, in the post with this, I link different compression socks, and there are actually even ankle compression socks. If you're like, Hillary, there's zero chance I can have more on my calves. I totally get that because I live in Phoenix. But even the ankle compression socks, I think help restore that blood flow. You know, not as good as the knee highs, but it's something. Sometimes I'll wear those on shorter flights when I'm like, I do not need the whole calf, but I'll do my feet. So again, all of those are linked in that post. And if you're planning on traveling, 100% make sure that you're wearing compression socks because you are at an increased risk for a blood clot. I also have a post linked in that post about third trimester travel if that is you. Now, these are what you need, but what about some of the mistakes people are making during their third trimester? I have a whole video on different mistakes that people are making. I'm going to link it up above and also down below. Thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. I had symphysis pubis diastasis.